If you're over 65 or you have parents or loved ones in that age group, there's something important you need to hear. You know, there's a daily habit we all think is essential for good hygiene and health. But the shocking truth is, this very habit could actually be silently harming seniors every single day. Yes, I'm talking about bathing, daily bathing. I know it sounds strange, right? After all, we've been told our entire lives that staying clean means staying healthy. Well, here's the thing. I'm a doctor with over 20 years of experience treating elderly patients, and I've seen something different, something most people don't want to believe, but ignoring it could be deadly. I've personally treated numerous cases where seniors have fainted, slipped, or even suffered heart-related complications, all because of their daily bathing routines. And every winter, I see heartbreaking cases of elderly patients collapsing in their bathrooms just because of a simple bath. So please, if you're a senior, or if you have a parent who insists on bathing every day, stay with me until the end of this video. Because what I'm about to share with you could save a life, maybe even yours. Before we dive deeper, I just have a quick favor to ask. If you find this information valuable, take a moment right now and hit the like button and subscribe to our channel. Your support means everything, and it helps us keep delivering practical, life-saving tips directly to you and your loved ones. Okay, are you ready? Because now, I'm going to reveal the 5 shocking truths about bathing after the age of 65, truths most people have never heard before. Trust me, you don't want to miss this. Fact 1, hot showers can be harmful to your heart. Taking hot baths can actually be dangerous for your heart. You might be wondering, how could something relaxing like a hot bath be harmful? Well, here's the thing. When an older adult steps into hot water, the heat causes blood vessels to rapidly expand, and this makes blood pressure suddenly drop. Now, for younger folks, this might just mean feeling a little dizzy. But for seniors, especially if they have high blood pressure, heart disease, or weaker circulation, this sudden drop can be extremely dangerous. I'll never forget one patient in particular, a kind, 90-year-old man who proudly told me, "Doc, I've taken a hot bath every day since I was a teenager. That's why I'm so strong." And you know, he seemed perfectly healthy until one icy January morning when he collapsed from a heart attack, right in his own bathroom. Thankfully, his daughter checked on him just in time. He ended up in the ICU and never bathed alone again. You see, after 65, your body's nervous system, the system that controls your heart rate, blood pressure, and temperature regulation, starts to weaken. It simply doesn't handle sudden changes well anymore. Doctors call this orthostatic hypotension, or orthostatic hypotension, which basically means your blood pressure drops dangerously low, and you might faint or worse. Did you know, when someone over 65 bathes in water hotter than 106 degrees Fahrenheit, that's about 41 degrees Celsius, for more than 15 minutes, the strain on their heart increases by up to 30%. That's like going for a jog, except you're standing in a slippery bathtub instead of safely walking on a treadmill. So, what can you do to stay safe? Here are some simple tips I always recommend. First, lower the water temperature. Keep it between 100 and 104 degrees Fahrenheit, warm, not hot. Use your wrist or the back of your hand to check. It should never feel scalding. Second, limit your bath or shower to no more than 10 minutes. This gives you enough time to clean up comfortably without overwhelming your heart. Third, stay hydrated. Drink a full glass of water before and after bathing because seniors are especially prone to dehydration, which can make blood pressure drops even worse. Fourth, sit down. Use a sturdy shower chair every single time. This greatly reduces the risk of slipping or fainting. And finally, never bathe alone, especially if you're over 80. Always let someone nearby know you're in the bathroom or consider getting an alert system. I know these small changes might feel inconvenient at first, but trust me, they could literally save your life. Fact 2, showering every day can seriously damage your skin. Daily bathing can severely damage elderly skin. Look, I get it. We all love that fresh, clean feeling after a nice shower or bath. But here's the problem. The older your skin gets, the more delicate it becomes. Daily bathing, especially with hot water and soap, can strip away essential oils, making your skin dry, itchy, and fragile. Did you know, after age 65, your skin produces only about half the natural oils it did when you were younger? That means every single bath or shower is taking away the little protection your skin has left. Let me share a quick story about Mrs. H, a lovely 78-year-old patient of mine. She came to see me because she couldn't sleep at night. Her skin was constantly itching, burning, and red all over. When I asked her about her bathing habits, she said, "Doctor, I'm just very clean. I scrub myself from head to toe every single day." Well, after some tests, we discovered her skin was so dry and cracked, it had tiny cuts, making it vulnerable to infections. She asked me sadly, "Did I do this to myself, just by trying to stay clean?" Unfortunately, the answer was yes. In fact, in a study I conducted with a group of dermatologists, we found elderly people who bathed with soap more than 4 times a week had a 60% higher risk of developing seriously dry skin. And you know, dry skin isn't just uncomfortable, it can be dangerous. When your skin cracks, harmful bacteria can enter, causing infections. I've even seen patients hospitalized because of these infections. So what's the solution? Here's what I recommend for seniors, based on years of experience. First, reduce baths or showers to about 3 times a week. I know it sounds unusual, but giving your skin a break allows it to restore its natural protective oils. Second, use soap sparingly. You don't need to scrub every inch of your body every day. Just focus on areas like your armpits, groin, and feet, areas that truly need extra cleaning. Third, always choose the right soap. Look for mild cleansers labeled pH balanced or gentle for sensitive skin. Regular soap is usually too harsh and strips your skin's protective barrier. Fourth, and this one's important, moisturize immediately after bathing. I call this the golden 3 minutes. Pat your skin gently with a towel, don't rub, and apply moisturizer right away while your skin is still damp. This locks in moisture effectively. Lastly, choose moisturizers containing ingredients like ceramides, and hyaluronic acid. These ingredients deeply hydrate your skin, keeping it healthy, soft, and protected. These simple adjustments will help keep your skin safe, comfortable, and healthy as you age. Remember, your skin deserves kindness, especially as you grow older. Fact 3, there's a high risk of falling in the bathroom. Here's shocking truth number 3, bathroom falls are extremely dangerous for seniors, and recovery is harder than you think. You know, the bathroom is supposed to be a place of cleanliness and relaxation, but for older adults, it can become one of the most dangerous places in the house. Falls in the bathroom are actually the #1 cause of serious injuries for elderly people. And believe me, I say this not only from research, but from seeing it happen far too often with my own patients. Let me share a story that I'll never forget. Last winter, an 88-year-old gentleman slipped while stepping out of his bathtub. Just like that, one moment of imbalance and he fractured his hip. He was rushed to the hospital, went through surgery, and while the operation itself went well, his life was never the same afterward. He lost most of his mobility, had to move into assisted living, and completely lost his independence. One simple fall didn't just break his bone, it broke his entire routine, his confidence, and his freedom. Here's a chilling fact: nearly 40% of bathroom falls happen during or just after bathing. And seniors who suffer serious injuries, like a fractured hip, face an alarmingly high risk afterward. Research shows that about 25%, that's 1 in 4 seniors, who break a hip won't survive past the first year after the injury. It's devastating, and most people don't realize just how serious a simple fall can be. So why do these falls happen so frequently in the bathroom? There are 3 main reasons. First, slippery floors. Water mixed with soap creates an almost invisible, but extremely dangerous surface. Second, rapid blood pressure changes. Standing up after bathing in hot water can cause dizziness or fainting. And third, loss of balance and strength. As we age, our muscles get weaker, our reflexes slow down, and coordination isn't what it used to be. All these factors create a perfect storm. But the good news is, these risks can be dramatically reduced with some very simple steps. Install non-slip mats inside and outside your bathtub or shower. This alone can prevent most slips and falls. Add safety handles near the bathtub, shower, and toilet. Trust me, these can be lifesavers. Always use a sturdy shower chair. Sitting while bathing has been shown to lower the risk of falls by more than 90%. Take your time. Move slowly and stand up gradually after your bath. If you feel dizzy, sit back down and wait until you feel stable. And finally, never hesitate to ask for help, especially if you're over 80 or if you live alone. Pride should never come before your safety. These simple changes can make the difference between a relaxing bath and a life-changing accident. Please take them seriously. Your health, your independence, and your happiness depend on it. Fact 4, sudden drops in body temperature after showering can be dangerous. Temperature control after bathing is crucial, yet almost always overlooked. You see, As we get older, our bodies become less effective at maintaining a stable temperature. Did you know that seniors over 80 have about 40% less ability to adapt to temperature changes compared to younger adults? Let me tell you about a patient who deeply impacted me. Last January, a sweet 92-year-old woman decided to take a nice warm bath before bed. She didn't dry off completely and then sat down in a slightly chilly room afterward. Within just 1 hour, her body temperature dropped dangerously low, down to about 94 degrees Fahrenheit. That's hypothermia, and she ended up in the emergency room. Thankfully, she survived, but this could easily have ended differently. So here's the thing, proper temperature management after a bath isn't just about comfort, it's about safety. Here's what I always recommend. First, always warm up the bathroom beforehand. A few minutes with a small heater can drastically reduce the temperature shock when you step out of the warm water. Second, dry yourself immediately, thoroughly, using a warm towel. Leaving moisture on your skin cools you rapidly, especially in colder months. Think of it like sweating. As the water evaporates, it pulls heat away from your body. Third, put on warm clothes right away. That means warm socks, a robe, and definitely dry your hair completely. Wet hair acts like a wick, pulling warmth from your head and making your whole body colder. Fourth, try drinking a warm beverage afterward. A hot cup of tea or warm milk helps raise your internal temperature gently and effectively. And lastly, adjust your bath time. The best time for seniors to bathe is usually between 2 and 4 p.m. when temperatures are naturally warmer. This helps minimize the risk of sudden temperature shocks. These might sound like small steps, but trust me, they make an enormous difference. Because remember, for seniors, keeping your body temperature stable after bathing isn't just comfort. It could literally save your life. Fact 5, being too clean can weaken your immune system. Being too clean can actually weaken your immune system, making you more vulnerable to colds, infections, and other illnesses. I know this might sound strange at first, because most of us were taught that cleanliness is always a good thing. But here's the surprising fact, your skin isn't just a simple barrier. It's actually home to millions of helpful bacteria, what doctors call the skin microbiome. Think of these good bacteria as your skin's personal bodyguards. They work constantly, day and night, to protect you from harmful germs and infections. But here's the problem. When seniors bathe too frequently, especially with harsh soaps or antibacterial products, they actually wash away these protective bacteria. For younger skin, it's usually not an issue. It bounces back quickly. But for people over 65, the recovery process is much slower and more delicate. Let me tell you about a patient of mine, an 83-year-old woman who came to my office with repeated skin infections, painful rashes, and severe dryness. She told me, "I shower every day and I use strong antibacterial soap. I'm trying my best to stay clean." Unfortunately, by trying so hard to stay clean, she'd unintentionally destroyed her skin's natural defenses. Her skin was left cracked, dry, and vulnerable to infection. When we changed her bathing routine, she quickly improved. Her skin healed, the infection stopped, and she felt healthy again. In fact, a recent study I was involved in showed that seniors over 75 who bathed daily with soap had a 35% lower skin immunity compared to those who bathed only 2 to 3 times per week. So, how can you keep your skin healthy without compromising your natural defenses? Here's what I recommend. First, limit your baths or showers to 2 or 3 times a week. This gives your skin a chance to recover its protective barrier. Second, avoid antibacterial soaps or body washes. They don't just remove harmful bacteria, they remove the good bacteria too. Instead, use gentle, pH-balanced cleansers designed specifically for sensitive or elderly skin. Third, use soap only on key areas like your armpits, groin, and feet. There's simply no need to scrub every inch of your body every single time. And finally, keep the humidity inside your home between 40 to 60%. Dry air damages your skin barrier, but a simple humidifier can help keep your skin healthy and your immunity strong. I know changing lifelong habits isn't easy, but small adjustments today can lead to huge health improvements tomorrow. Remember, your skin is your first line of defense. Protect it, and it will protect you. So let's quickly recap what we've covered today because I know it's a lot to take in. First, taking hot baths can put dangerous strain on your heart. Second, bathing every single day can seriously damage your fragile skin. Third, bathroom falls pose a major risk, and recovering from them can be extremely challenging. Fourth, managing your body temperature after bathing is crucial, yet often overlooked. And fifth, being overly clean can actually weaken your immune system, leaving you more vulnerable to infections. Now, I understand some of this information might surprise you or even challenge long-held beliefs. But trust me, these adjustments, though small, can dramatically improve your health, safety, and overall quality of life. Because, aging doesn't have to mean giving up your independence or your comfort. With just a few simple changes, you can stay healthy, strong, and safe for many years to come. If you found this video helpful, please take a moment right now to like, subscribe, and hit that notification bell. That way, you'll always receive the latest practical, life-saving advice. Thanks so much for watching. Stay safe, stay warm, and always take good care of yourself and your loved ones. I'll see you next time.